Michael. So as Michael said, I'm Niamh Mellor from Public Health and Insight team, and I lead on Coventry Joint Strategic Needs Assessment. So I'm going to talk a little bit today just about what a JSNA is, how it fits in a wider context of population health, what we did in Coventry and our approach to it, some key facts, and then we're going to hear from Sharon Thomas from the Community Resilience team about how she's utilised some of the work and used it in her own area. So to begin with, for a little bit of context, we've based our JSNAs heavily on the King's Fund model of population health. So population health is an approach that aims to improve physical and mental health outcomes and to promote health and well-being and reduce inequalities across an entire population. So this focuses both nationally and locally on how we can work together to minimise the impacts of wider determinants of health. So it presents a vision and 4 pillars. So there's a report that I'll link to at the end of this presentation with 4 pillars on how we can successfully achieve this. So firstly, it focuses on the wider determinants of health. So they're one of the most important drivers. So in addition to income and wealth, it looks at things such as education, housing, transport, and leisure. The next pillar here on the right is our health, behaviour and our lifestyles. So that looks at smoking, alcohol consumption, diet and exercise. So an example of this is over the last 50 years, we've seen a reduce in smoking rates, which has significantly raised our life expectancy. However, now we're seeing increased obesity rates, which is significantly impacting the life expectancy now. So that's a very important factor. We look at places and communities, so our local environment, so that has an important influence on how healthy we are as an individual. There's a really strong link between social relationship and community networks, especially on our mental health. And then finally, the 4th pillar in the vision is integrated health and care system. So this reflects a growing number of patients with multiple long-term conditions and a need to integrate health and care needs of services around the needs of those people rather than working in those organisational silos, focusing on prevention instead of firefighting constantly. So with that in mind, these 4 pillars are the population health system. And as a concept, this isn't new. However, the elements here in the purple, the balance between how much resource and time is contributed to them isn't balanced. So the King's Fund's approach searches for a more balanced approach in all of these elements to join together in balancing out that system. So the JSNA kind of fits in with this, being used as a tool to support that and to support that ethos. So it brings together lots of data and information about the health and well-being of the people in Coventry, and it's used to support planning and commissioning of health, well-being and social care services. So they're a tool within that population health framework, creating that evidence base. They're owned by the Health and Wellbeing Board and they are a statutory obligation, so we must every 3 years produce a JSNA. This is great because the Health and Wellbeing Board is made up of lots of different partners, and so it's not just a local authority document, it's been influenced by lots of different people. However, both positive and negative really is that there is no one way to do JSNAs. There's no framework that we must follow, there's no data that we need to include. So local authorities can really shape them in whatever means they need. So if you look at ours compared to Warwickshire, for example, they take a thematic approach, whereas we take a slightly different approach here in Coventry, which I'll talk about in the next slide. Our approach historically has been to produce facts about Coventry, and that still exists. And I encourage you to have a look on the website because the Insight team have done a brilliant job of facts about Coventry. And it came along with the JSNA handbook, and that was a data book that was used to inform the health and wellbeing strategy. But since 2019, the Health and Wellbeing Board agreed to move to a more place-based approach. So this combines that data that we already had in our facts about Coventry and our data book, but also looks at exploring some of the meanings behind that. So we look at the community intelligence side, we look at assets within the community. So we've done one overall citywide profile, which looks at the city as a whole, and then we've done 6 smaller deep dives, which I'll talk about in a few slides' time. But they still inform the health and wellbeing strategy and the priorities. So here you'll see that we've heavily been influenced by the Kingsford model. Health is more than just a healthcare system. It's more than that. It's linked to people's economic and social circumstances. So for us, taking a place-based approach has enabled us to really have the opportunity to explore different assets and nuances between different communities, draw on the skills and strengths in each of those areas. We worked very closely with our community resilience team, who are brilliant. They've got ward coordinators in each of the 18 wards, so we've been able to talk to community groups and residents and really paint a picture of what it actually is like to live in Coventry and in the neighbourhoods that we're researching. So for each of our profiles, we look at the demographics. So do people have access to a good family network, to friends? What are the demographics like and how does that influence health outcomes? We look at the prospects, the opportunities people have, access to jobs, the economy, education. We look at housing and environment, so whether people feel like they live in safe areas, what's the housing like in those areas, do people have access to green spaces? All of these are very important and influential in how healthy you are. And of course, we also look at the health and well-being, so that looks at both lifestyles and also more health-focused data. So it collects lots and lots of different data and statistics, but balances it out with engagement. And we ask throughout each of the profiles and each of the 6 profiles, why is this important? What is our local picture and how does that compare to other places? What's happening in the city and what else can be done? So I think that's the real focus in those stories, in what is happening in community groups, what's happening and what else can we do to collaborate more on that? So I mentioned previously, and I'll skip through this briefly, but this was one of the most difficult parts of our process in the JSNA, and it was finding and mapping what areas we would do our deep dives in. Ideally, you'll see there's a lot of grey there. We would have liked to do the whole city. We're a very small team, so we had to choose neighbourhoods based on highest levels of deprivation, lowest levels of life expectancy, but we also wanted to include things of assets and community groups that we could use to tap into and utilize on it. So that influenced us slightly. There were many different ways. We could have done it by wards, by primary care networks. We did family hub networks. But after workshopping it with community resilience team, with the insight, community groups, what it meant and where people saw themselves, we came up with custom boundaries for each of these areas. The plan moving forward in the next round, after we've evaluated this, hopefully we continue to kind of fill in those grey bits, and just keep working and building a profile and a bigger, more in-depth picture of Coventry. So we began by asset mapping. This is available online. We looked at community centres to begin with. We looked at each of the profiles, so each of the demographics, the prospects, housing and environment, and health and wellbeing. And we looked at what people had in their areas near them. We looked at how far it was to get to GPs. We looked at transport links. We looked at a variety of different assets within the area, which is all available online. We also, as I've mentioned, combined it with quantitative data. This is just an overview of some of the information that are within the profiles. They're a fountain of knowledge, and this comes along with a data handbook. So if anybody was interested in the raw data or information that we'd used, there's a data handbook online, which I'll send a link to, so you could build your own profiles as well if you wanted to use some of that. And the final element, that's jazzy. And the final element was Let's Talk Coventry. So we have an engagement platform, Let's Talk Coventry, which is brilliant. And if you've not seen it, definitely have a look. It's where we put all of our surveys and consultations for people to enable people to have their say in things that affect them. So we put our JSNA online. So we had residents fill in, tell us about your area, so people were able to say what was good about their area, things that they wanted to improve, as well as connections mattered. So things that people felt connected to and the importance of those social connections. Just given a little bit of background into what we maybe couldn't gain from the quantitative data, and that's something that I feel has worked really well throughout our JSNAs, is that we've been able to work with our insight team and community resilience and engagement team in looking at that data, seeing if it makes sense, and if it doesn't make sense, why doesn't it make sense? And that's been something that's been able to give us a unique insight into some of the areas in Coventry. I'll just briefly, because as I've mentioned, they're huge documents, so I don't have time to go into each of the four. But this is, again, on the website, a data pack on the demographics and community aspect of our citywide profile. So we have these for each of our 6 profiles as well. So it says here we can see that Coventry is a young, diverse and growing city. It's got a median age of 35 and a population that continues to grow. So between censuses, there was an 8.9% population growth in the last 10 years. That outpaced England's 6.6% and makes us the second largest local authority in the West Midlands. Now, that growth hasn't been concentrated equally in different areas, so we can see that Whitley and Talbot End, Henley Green and Wood End and Central Coventry were the fastest growing. But it kind of gives a feel for how rapidly we are expanding. While younger adults do drive a lot of this population growth, we're home to 2 university cities, so we do have a lot of young adults. It is important to remember our working age population, as preventative health is going to be increasingly important over the next coming years. Our education outcomes are improving as well as a city, but we do still have high levels of children living in low-income households. Digital exclusion still worsens those inequalities, although the fabulous work of Cov Connects is doing a lot to minimise those inequalities. We found that most residents do have good access to services, although some of those services are below national average. So it's important to kind of take that into account when planning services. And finally, what I want to touch upon is the health disparities between the areas. So it's stark. Life expectancy across Coventry can vary up to 10.7 years for males and 7.8 years for females. And just to kind of visualize that a little bit, I've got a map here of Coventry's number 7 bus route. So Coventry number 7 bus route runs from Brownshill Green over here in the northwest and Bell Green over here in the northeast of the city, and it crosses some of the city's most affluent areas as well as the most deprived areas. So this is just one bus route within Coventry, and it shows that along this bus route, people living over here in Henley Green, so it's towards the right, I'm not sure if you can see my cursor, have the lowest life expectancy of 73.5 years for males and 79 years for females. And then people living across here in Orsley Green have the highest life expectancy at 80 years for males and 86.6 years for females. So that's a difference in life expectancy of 7 years on one bus route, which shows why it's so important to really get an understanding of those social determinants of health. So finally, before I hand over to Sharon, I just thought I'd show a little bit of how the JSNAs have been used and maybe get you thinking about how maybe you could use them in your own work. We've used them for our equality impact assessments. We've used them as a basis for One Coventry Hubs, so that looks at integrating services and providing a collaborative effort and services all in one place. We've worked with our ICB colleagues and community integrator programme, so they were very interested in our neighbourhood approach and how maybe they could reflect that in their work moving forward, as well as the marmot monitoring tool, which focuses heavily on the social determinants of health. But I think one of the most interesting ways in which it's been used is by the community resilience team. And Sharon, if you'd like to come in now and just how you've maybe used it in your work, take it away.
Thanks, Niamh. Right, so for those that don't know, the community resilient team basically support the voluntary sector, and that's in we run partnership groups, stakeholders. We put people together that might be useful for them to work together, and it's really about getting the external resources to them to support them moving forward, because often they are supporting the most vulnerable in Coventry. We're a small team. We're down to 5 now, so we have to be really choosy about who we support and what areas. But we're using the JSNA data to guide us, actually, because realistically, they are the 6 areas that the JSNA has pulled out as the areas that most needed. Mostly we get asked for funding application support, which is fine, and the JSNA data actually shows needs. So we use this with the voluntary sector, because actually with any good funding application, you've got to have good data to show actually there's need in that area, particularly with the lottery. And also often organisations will come to us and say, well, you know, we need some core resources to run our centres, because quite a lot of them run community centres, but actually funders won't. It's really difficult to get core costs. So actually, you have to say to them, do you know what, you need to run a project. And looking at the JSNA data, these are the sort of things that groups that you should be targeting for those areas. So if we looked at when, for example, you'd be looking at quite a high level of sort of lone parents. So you'd be looking at projects that would look at lone parents. And in Canley, we know there's a lot of young mums that smoke. So in terms of from that perspective, you would be looking for them to get some grants by public health, which has happened, and to support people to give up and signpost them to where it is. So as I said, lots of organisations, they come to us for looking for funding, and we do use the JSNA data, but it's also important to remember the context. For example, in Hillfields, we know there's a massive need. We've got 2 organisations that are funded by the lottery long term, which they have been, and for our team particularly, we've sort of not avoided it, but actually there's only a small amount that we can do to support them, because they've got the resources in place. But actually on top of that, they're running at full capacity. They can't do more because they can't physically do more, and there's no more community buildings in Hillfields for them to do more work. So actually knowing that that context is important, so we can have data, but actually I think from our team perspective, it's that local knowledge that really makes a difference. So I thought I'd give you a bit of I suppose, a bit of an example for that. So Dominion Grace came to us looking for funding. We've helped them before. They run a breakfast club on a Saturday. They've been running it now for coming up for 2 years. We supported them with the first application, and they got £10,000 to run a breakfast club. And actually, if you look at the JSNA data for Willenhall, it's actually quite densely populated. And Binley and Willenhall are quite different in terms of Willenhall. They're quite young. They've got 21% of their children between 0 to 15, compared to the citywide 19%. So actually, it's quite young. Whereas in Binley, the average age is 43, so you've got an older population. So you've got quite young and quite old, quite next to each other. So that's the sort of thing that's really important. So it also tells us that there's a lot of lone parents, 10.8% compared to 8.3% on the city. Low income, 16% compared to 8% citywide. And actually, where you've got poverty, you will expect that some of them will be digitally excluded as well. And of course, smokers and hazardous drinking, 12% compared to the 4% citywide. So actually, there's a few things that it's telling us there. So the Dominion Grace have come to us asking for resources, and we've thought, great, they're quite established now. They've got they've traditionally been running it for people that they do, people with educational needs, provide a waiter service, which is really lovely to see. So they're learning new skills for other people in that community, and the ages are really from a sort of 1 up to 80 years, and they've got anywhere between 80 and 120 people turning up to that at the moment. So it was important for us, the team, to support that, because they're supporting young families and old people, which so we've got a captive audience. So sorted them out funding. Thankfully, we got it. They got £20,000 for 2 years, which is good news. But on top of that, we thought, well, let's have I said to him, we need to look at your digital exclusion. Perhaps you could have laptops and things running alongside that. And actually, because we've got some older people there that might need to access the NHS app, for example, that might be struggling. And we could apply to Cov Connects, which they've done, and they've got some laptops. And perhaps while you're also doing that, perhaps look at smokers, perhaps train some volunteers, and we sort of asked them to go for a public health grant to get to actually get a small amount of money, but I think they went for £2,000 to run a table, a smoke-free table, where they could have information set up on laptops while they're having breakfast, for people that want to give up smoking or want some information on it. So really, it's we've not pushed them into that, but actually they've got more resource, they're targeting the right groups, they've got 2 years worth of funding, and on top of their normal their normal breakfast club, it's at the Haggard, as I've just said, whereas on top of what they would normally do, they're actually targeting some health inequalities with the smoking cessation and the digital exclusion. They've got some digital units. The centre had, I think, digital units. They're called something else. Basically, it's Wi-Fi at the centre, because actually it's quite poor as well. And they were finding they were struggling. So they've got some Wi-Fi units that can be set up that can be used not when the breakfast club is closed, but for other people that might use the community cafe in the week. So the JSNA data is important, and we use it, and I think the voluntary sector perhaps are using it more than some council departments, I would say, because we're pushing it, and actually they're genuinely interested to hear about what the data is telling us. But more important, it's just going to make us better at doing what we do. Bearing in mind we've got such a small team, and of course the voluntary sector are struggling for resources, and while we're here, it's good that we can sort of help them to move forward. That's me, Niamh.
Thank you, Sharon. I'm always just amazed by how much work you're a tiny team as well, and just how much work goes into each of your groups in the city is amazing. So that was just a practical example of how maybe it could be useful to other people in different areas of work on the call. And I'm just going to finish off by saying the reason I'm here today, and thank you to Michael and this opportunity, is to promote it as a tool, as a resource. It's a continuous process, providing a local health and wellbeing based picture of local needs. We're in the process of evaluating it, and we're moving towards a refresh in 2026. So I'm sure you'll be hearing more from me in the future. And there's links here on the slide. Michael, I presume you'll be sending them out. And if you want to have a more in-depth conversation, because like I said, this is a real whistle-stop tour. If you've got any more specific questions or anything, do please contact me. My email address is on the front slide. But I'm happy to take questions now before I go.